Welcome to today's presentation on joint replacement surgery. My name is Anna Serra and I'm the Program Director for Surgical Services and Critical Care here at Greenwich Hospital. I'd like you to know that we are taping this program and we'll have a tape copy available for viewing on our Greenwich Hospital website, www.greenwichhospital.org, in just a few days. Our Center for Joint Replacement became one of the first facilities nationwide to receive the Joint Commission Gold Seal of Approval for total hip and knee replacement surgery in 2012. This certification recognizes our commitment to maintain clinical excellence and patient satisfaction while continuously working to improve patient care. This recognition sets us apart from other facilities. Our very own nurse coordinator, Tori Kroll, helps patients every step of the way, before, during, and after surgery. Our patients receive the practical information, emotional support, and the follow-up care that they need to guide them through the entire process. Our format for today's program will include 6 presentations that will take you from preparation for surgery to updates on knee and hip joint replacement surgery, total shoulder surgery, and then to the special attention we pay to pain control, and finally, post-op physical therapy and rehabilitation. We ask that you hold your questions for the Q&A session that will follow the presentations. At that time, all 6 presenters will address all your questions. You should have received an index card when you arrived this evening. Please feel free to write down any questions that you may have. Our staff will collect completed index cards following the presentation. May I trouble you all, out of respect to our presenters and to you as the, our customers that are here, to please turn off your phones. Thank you. And now it is my pleasure to introduce our first speaker, Tori Kroll, who will speak about preparing for surgery. I would like to take this opportunity to personally congratulate Tori on her 35 years of service here. A big landmark. A round hand of applause. Tori?
My name is Tori. I am the coordinator of the Total Joint Program here at Greenwich Hospital. I have worked here for 35 years. And several years ago, we started a preoperative class for patients who are having total joint replacement. And I kind of liken having a total joint replacement to taking a journey to a place that you've never been before. And just like you wouldn't get on a plane or some mode of transportation and not know where you're going, who's going to be there, you don't speak the language, what's going to happen when you're there, how you're going to get home, I don't think that most patients would feel comfortable venturing into a total joint replacement without knowing anything about what's ahead. So we really started the class for 2 reasons. One is that I think that most patients have very natural, very normal concerns, apprehensions, sometimes out and out fears. If we can help allay any of those for you by doing the pre-op class, that's one reason that we do it. The other reason is that we really think that the more you know going into this surgery, the better you do post-operatively. So what we do, and this is for patients who have either signed up for surgery and have a surgical date that they're coming into the hospital, or just for patients who are seeking more information and haven't really committed to anything yet. Anyone can come. What we do is we take you through your joint replacement starting several days before your surgery, and kind of walk you through your whole hospital stay. After I'm done speaking at the class, one of the physical therapists comes and gives all the patients an overview of the physical therapy involved, both before and after the joint replacement. And then when she's done speaking, one of the discharge planners comes and discusses discharge planning with patients, which is basically whether you're planning on going home with rehab services at home or to an inpatient rehab facility from the hospital. So just basically, I'll just breeze through what I go through in the class is we talk a little bit about optimizing health and nutrition and hydration before you come into the hospital. We discuss pre-op clearance, medications to avoid prior to surgery, and all the things that are necessary to do prior to coming into the hospital for your joint replacement, which I really kind of liken to a full-time job. It's a lot of work, but very well worth it. And then we discuss what actually happens during the hospitalization, the whole admission process, the whole nerve block and anesthesia protocol, which I'm not going to steal Dr. Krastowski's thunder. He'll tell you all about that. Pre-op medications, post-op medications, what to expect in the operating room and the recovery room, and then really the whole post-op course from waking up in the recovery room through discharge, and progression of activity and mobility, pain management, preventing complications such as pneumonia, blood clots, infection, which we do very well at, and cover any aspect that patients might expect during their hospital stay. And then we speak also about the discharge process. After patients come to class, I call everyone prior to their admission into the hospital just to see if they have any questions. Patients are always free to call me. I come and greet patients in the pre-op area if I can on the day of their surgery. And then I see all of our patients post-operatively at least once a day. I bring patients discharge instructions the day prior to leaving the hospital so that you have time to go through them. Then I come and sit with patients the morning of discharge and answer any questions that you might have. And then I call patients both 3 to 4 days, and either myself or one of my coworkers calls again at about 5 to 6 weeks post-op just to see how you're doing. And that's whether you go home or to a rehab facility. So we're really with you to support you the whole way through and beyond, which, and far beyond, which most other programs don't do.